we started looking through and looking for states and locations that were real hot spots of activity for clinical trials. What states were doing it right, had shown real leadership, and could really talk about some best practices for the public-private partnerships that it takes to get clinical trials on their map. And New York just kept coming up. New York, New York, New York. As it turns out, New York hosts about a third of all clinical trials in the nation.
Years ago, when I was in training, there was only a very limited number of treatments we could offer our patients. And what's amazing now are there novel targets, new treatments. The side effects that we used to see in the old days, that we saw what we call nonspecific toxicities, was that we used drugs that killed cancer cells, but killed just as many normal cells as well. Now we have targeted therapies at a point where we can pinpoint a molecule inside a pathway inside the cancer cell, that when that's used, and now we're actually developing pills instead of always, not all these treatments are IV therapies, that actually can be used and kill the tumor cell. Now the trouble is, what is the optimal use? What is the best combinations? That takes clinical trial participation.
As the report which is being discussed right here today discussed, biopharmaceutical clinical trials are an important driver of economic activity in New York State, creating jobs, increasing tax revenue, and supporting research expenditures. New York State has a competitive advantage. New York State has a competitive advantage in the medical research field. And this is an important element to progress for all of us in Western New York.
This is about exactly what this poster up here says: developing cures and creating jobs. This is about taking that $1.2 billion in research and development for clinical trials and putting it into the Buffalo and Western New York economy to help make our community grow, at the same time saving lives.
The main point is these biopharmaceutical companies recruit employees in the fields of life science, research, manufacturing, management, executives, office and administrative support workers, as well as engineers, architects, computer and math experts, and sales representatives in Buffalo. I don't think anybody thinks about that, how wide of an area that actually expands. So we need to keep the fight for economic development that supports the jobs with a variety of skilled and unskilled labor. It's very important to this region.
My lymphoma is the least of my concerns. And I have to say, based on the funding and the great research and actions of pharma and Dr. Chutchman, and the support we get from our elected officials and all the researchers and volunteers and anybody that's involved in the areas of cancer research and treatment. I was fortunate to retire 3 months ago after 24 years on the force. And most importantly, I achieved one of the things on my bucket list that I vowed I wanted to achieve when I was first diagnosed in 2003. And I got to watch my daughter graduate from Kleinhans last week from high school. And hopefully we'll be able to see my son do the same thing in 2 years.